Bismillahirrahmanirrahim. So the next topic of our discussion is urolithiasis. So let's break down the terminology first. Uro means urinary tract, lith means stone, and cis means formation or synthesis. So urolithiasis is formation of stones within the urinary tract. It is more common in males than the females, and the most patients present between 20 to 30 years of age. Urinary tract stones can be of four types. The most common is calcium oxalate and calcium phosphate stones. The second one is struvite stones, followed by urate and cysteine stones. So calcium oxalate and calcium phosphate stones are the most common type of the stones found within the urinary tract, constituting almost 80% of all urinary tract stones. So these stones are formed as a result of increased calcium intake, hyperparathyroidism, and diffused bone diseases. So all of these three mechanisms increase the calcium in the blood, resulting in hypercalcemia. So this excessive calcium is excreted in the urine, resulting in hypercalciuria, which favors the formation of stones within the urinary tract. Almost 55% of the patients with hypercalciuria have normal level of calcium in blood. The hypercalciuria in such cases could be due to increased calcium absorption from GIT. It could be due to impaired renal reabsorption of calcium, or in certain cases it is idiopathic with normal PTH levels. So the stones found by the calcium oxalate and calcium phosphate are radio-opaque, which means they are visible on the X-ray films. Calcium oxalate stones appear dark or blackish in color, whereas calcium phosphate stones appear pale or whitish. Struvite stones are typically more common in women than the men, and they constitute almost 10 to 15% of total urinary tract stones. Struvite stones are formed as a result of infection with urease positive bacteria such as Proteus. So urease enzyme actually breaks down the urea into ammonium ions, and these ammonium ions combine with magnesium and phosphate to form magnesium ammonium phosphate salts. These salts ultimately precipitate to form struvite stones. Struvite stones are typically large and formed in the pelvis of the kidney. These stones can be so large that they can completely fill the pelvis and partially protrude into the calyces, forming horn-like structures. Therefore, it is also known as staghorn stones. The urate stones are formed as a result of hyperuricemia, which can be due to certain systemic diseases such as gout, or it could be due to increased turnover of cells, such as in leukemias. So excessive uric acid in the blood is excreted in the kidneys. Since the uric acid is acidic in nature, it brings the pH of the urine below 5.5, which favors the formation of urate stones. Unlike calcium and struvite stones, urate stones are radiolucent, which means they are not visible on X-rays. The next is cysteine stones, which are formed as a result of genetic defects in the amino acid reabsorption from the renal tubules. So as a result, there is excessive amino acid excretion in the urine, which turn the pH to acidic side. Acidic pH favors the crystallization of cysteine amino acid and result in the formation of stones. Cysteine stones are relatively less common and they are also radio opaque, which means they are visible on X-ray. So urolithiasis could be either unilateral or in rare cases it can also be bilateral. The most common site of formation of stones within the urinary tract is renal calyces, followed by the pelvis and urinary bladder. These stones can be either asymptomatic depending on the size of the stone, or they could be symptomatic. They typically present with the renal colic, which is due to obstruction of the urinary tract, and flank pain. Dysuria is also often present, and there could also be presence of blood within the urine. If there is an infection associated with the urinary tract stones, there could be fever and nausea as well. The diagnosis is typically established on X-ray, and exact size and location of the stone can be known on CT scan of kidney, ureter, and bladder. Treatment for the stones with less than 5 mm size is mostly conservative with NSAIDs and alpha blockers such as alfuzosin and tamsulosin. Larger stones, however, do require surgical intervention. Complications arising as a result of urinary tract stones include infection, hydronephrosis followed by pyonephrosis, and strangulation, when a small stone blocks the urine outflow from urinary bladder, resulting in severe pain. So this concludes our section of urinary stones. If you have any questions, do let us know in the comment section. Thank you.